Thank you everyone for coming. I'm so excited that you're all here. Today we'll be talking all about skin and how to optimize the health of your skin from the inside out. So just in case any of you aren't familiar with who I am, my name's Kim Vance. I'm a doctor a naturopathic doctor in Guelph at Natural Choice Medical Clinic. And I primarily work in the area of women's health. So I help women balance their hormones naturally, regain control of their reproductive health and fertility, achieve clear and glowing skin naturally, and optimize their gut health. And, I really got into this profession from my own personal health struggles. In my teens and in my 20s, I was quite sick, in and out of doctors' offices. I myself was struggling with quite severe skin conditions. I had quite bad cystic acne, as well as hormonal problems. I was fatigued. I was barely functional. And, naturopathic medicine really changed my life and it inspired me to do what I do today. So, everything that I'm talking about today, it comes from personal experience. I've been there. I know how rough it can be and what a toll it can take on your health, even your mental health. So I'm very passionate about this subject and it's very near and dear to my heart. So thank you for joining me. And I'm going to share all that I've learned with you. So, when we think about skin, typically what we're seeing is it's treated very much as an exclusively cosmetic issue. So, it's all about potions and creams and products and fillers and trying to achieve a certain cosmetic look. But I think that's a very narrow minded way of looking at it because skin really is a window into our internal health. It's so much more than just a cosmetic concern. And, what's happening on the inside will reflect on the outside. So, our skin is a gauge of how healthy we are internally down to the cellular level. So, when we're experiencing things like acne, psoriasis, eczema, skin rashes, rosacea, all of these are clues that are telling us that we need to look deeper at what's going on. So, you can think of the skin almost as an alert system, and it's alerting us that there might be an imbalance in your digestion, in your hormones, in your immune function, in your inflammation levels. And so, it's something that I take very seriously and not something that should be swept under the rug. So, there are a few main pillars of glowing skin and healthy skin in general. I've listed them here. The first one is gut health. So, you can think of digestion here. The second is diet. The third is anti inflammatory lifestyle. Fourth is functional detoxification and elimination. And the fifth one is the right skincare. So, I'm going to go through all of these in a bit more detail, but I do want to highlight that I've listed skincare as number 5 as the last item. And so this is because although skincare does help, it is not the answer to your skin concerns or skin woes. Skin really is an inside job. And so you can't really out skincare a not ideal lifestyle. So we really do need to put some of these lifestyle practices into effect in order to really achieve the kind of skin that we're looking for and to deal with some of the skin issues that I listed earlier that might be coming up. So let's start with gut health. Glowing skin really does start in the gut. And this is something that we've known since ancient times. Traditional Chinese medicine practitioners all the way back in the day were talking about how gut health is the foundation for all health. It's almost like the command center of the body. And so when you think about the gut, yes, it's important for digestion of food, but it's responsible for a lot more than that. So, digestion, yes, which means breaking down our food into pieces that can be digested, absorption of the nutrients from that food, and then dissemination of those nutrients to everywhere in the body, wherever they're needed. And then finally, elimination. And this entire process is what keeps our body going. And if it's not working effectively, we're going to see issues down the line. The gut also houses over 100 trillion bacteria. And just to put that into a little bit of context for you, the number of bacterial cells in our body outnumber our own body's cells 10 to 1. So we are more bacteria than we are human, which is kind of a really wild thought. Um, so the bacteria that live in our gut is also known as the gut microflora or the microbiome. And the emerging research right now is really telling us how important they are. They regulate just about everything in the body. And I mean everything from, we're learning that even anxiety and depression can come down to an imbalanced gut microbiome, the health of your immune system, your metabolism, just about everything. So this is why gut health is so important for not only overall health, but also the health of our skin. So, an imbalance in gut bacteria is also known as dysbiosis. And because of the huge impact that our gut microbiome has, it can cause a wide variety of health problems. So, gut health is definitely the foundation of healthy skin. So, to get a little bit deeper into what exactly those bacteria are doing for our skin, they actually produce some nutrients that are essential for the skin. So, just quickly, things like biotin, vitamin B12. They help us to absorb essential nutrients from the food we eat. They actually protect our gut lining and prevent inflammation from developing in the digestive tract. They reduce inflammation overall. They regulate sebum production. And this is really important because high levels of sebum in the skin are sort of the precursor to acne. And so they can directly influence acne. They influence our mood and emotions, which I talked about a little bit earlier, and they regulate our overall metabolism. So huge, huge implications for our health. So, some of the things that can go wrong in the digestive tract or in the gut. The first is malabsorption and maldigestion. So, malabsorption is when you're unable to absorb nutrients from the food you eat. Maldigestion is when you're unable to break it down for absorption. This is really important because even if you're eating the healthiest diet in the entire world, if you can't break it down or you can't absorb it, it doesn't matter. And so with my patients, I'm always assessing their or their absorption abilities, their digestive abilities, and I'm usually testing to see if there are any issues there. And so that's really a very important part of maintaining healthy skin. Then we have dysbiosis. So that's when your gut bacteria are out of balance. We can have overgrowth of certain bacteria, or we can have not enough good bacteria. And so, depending on what the imbalance is, it can cause different issues. This is especially important for autoimmune conditions. So, things like psoriasis or lupus, which can also cause lots of skin rashes and issues. Then we have intestinal permeability, which you may have heard of referred to as leaky gut. So basically, what this means is that the lining of your digestive tract has become inflamed. And when it's inflamed, particles start to enter the bloodstream from the digestive tract that should not be allowed to enter the bloodstream. And then this sets off a big inflammatory cascade. It makes your immune system flare up because your immune system's kind of going, what the heck is all this stuff in the bloodstream that shouldn't be here? And the end result is quite a lot of skin issues. So, skin rashes, psoriasis, acne, eczema, all these kinds of things. And then the last is impaired elimination, which, when we're talking about gut health, really just means constipation. And this is really important because when we're not eliminating our waste properly, what happens is it can build up in the body. And it can reflect in the skin. And it also can cause high levels of hormones that should have been eliminated from the body, but unfortunately have not been because things are a bit backed up. So making sure that you're eliminating properly is essential. So, how do you know if you have gut issues? There are going to be symptoms. So, you're going to have things like acid reflux or heartburn. You might have bloating and gas. And if you especially have the kind of bloating that's so severe, it almost looks like you're pregnant after you eat, that's a big sign of something called small intestinal bacterial overgrowth. So, that's something you should definitely have looked at. You might have constipation or diarrhea. You might have cramping and abdominal pain after eating. If you have less than one bowel movement a day, and this is what I was talking about earlier, we have to make sure that we're eliminating waste products properly. Incomplete evacuation. So that just means that you might have a bowel movement every day, but it's not a complete evacuation. So it feels like it's not quite finished. And then we have undigested food in the stool. And so corn is okay, other things are not. And this is a sign that you might not be digesting or absorbing. So that's usually an issue with maldigestion or malabsorption, which was the first thing that can go wrong in the previous list. So, when we're wondering what the heck is going on with your gut health, maybe you have some of these symptoms, you're not really sure what to do. We usually like to start with some testing. And so, I listed some of the tests here for you that are used to assess your gut health. And so, the first is something called a stomach acid challenge test, which is something that I lead my patients through to help figure out whether they have low stomach acid or high stomach acid that could be influencing their gut health. An ova and parasite stool test, which is kind of exactly what it sounds like. It's testing for parasites in the stool. A comprehensive stool analysis. This is the most exciting thing on the list. At least it gets me really excited, maybe not anyone else, but it takes a look at your gut microbiome. So it can look at all the different bacteria that exist in your gut and tell you if there's an imbalance. And then it also takes a look at some measures of your digestive health and digestive capacity. So very, very cool testing. Small intestinal bacterial overgrowth breath test. So that's the one I was talking about. If you're feeling so extremely bloated after eating, this test will help you figure out if you have an overgrowth of bacteria in the small tests that should be done. One is called an H. pylori breath test. That is, especially if you're having a lot of pain after eating, a lot of heartburn, acid reflux, you should always make sure that this test is done. This is because there is a bacteria called H. pylori. It can infect the lining of the stomach and cause a lot of problems. And so you always want to rule that out. You can do that with your family doctor. You don't need to do it with with a naturopathic doctor. And then the last is a celiac test. And this is because celiac disease causes a lot of digestive problems. And if it's present, it's very important to diagnose it because it can lead to some pretty bad health outcomes. So this is something you can test with a blood test or a biopsy, which does require you to go to a specialist's office and have a scope done. But these are some of the tests you should be thinking about if you think that there's something going on with your gut or your gut health isn't quite on point. So the main message with gut health is to not ignore your symptoms. Don't sweep them under the rug. If you think something is going on, investigate it, get tested, and treat it because it is the foundation for everything in order to build, an overall lifestyle that will support healthy, glowing skin. Next is, oh, actually, this is a good time to take a quick break and see if you guys have any questions. So we'll have time for maybe one or two questions. If we don't get to your question, like Carolyn said, you can still send them in. We will, collect them all and I'll do my best to answer them. Afterwards, we'll try and put together a document or something. So I don't know if I can see the chat. Carolyn, are you able to tell me if there are any questions coming in?
Yep, for sure. So I don't see anything yet. If anybody does have a question and you are typing it into the chat, just make sure that it's visible to either everybody or to at least the NCMC host, and then I'll be able to see them. So we have one here that says, what product do you use for gut health?
So this will really depend on what I find in terms of what's going on. If I highly suspect that there's an overgrowth of bad bacteria, then I might actually use herbs that are antimicrobial in order to get rid of that gut bacteria. If I suspect that there's intestinal permeability issues or leaky gut, then a really great one is called L-glutamine, and I'll like to use that. But the way you dose it is really important. So you always want to make sure you're working with someone who knows how to dose that. And then there are lots of other botanicals, which are just medicinal herbs that help to soothe the digestive tract. things like aloe, slippery elm, something called DGL or deglycerinated licorice. So any of those things I will consider, but it will really depend on the patient and what exactly is going on. So hopefully that kind of answers your question. Oh, I can't hear you, Carolyn.
I always mute myself just to be safe.
Mhm.
So the second question that came in is, where does IBS fit in this?
Oh, this is an excellent question. So, IBS is kind of an umbrella term, which loosely means we don't know what's wrong. And what we're really finding out is that IBS almost always is actually SIBO or small intestinal bacterial overgrowth. The two really come hand in hand. And so, whenever you're dealing with IBS or you've been diagnosed with IBS, I do recommend exploring the possibility of SIBO because we're learning more and more now as the research comes out that the two are really one and the same. So that's what I would recommend in terms of IBS.
Awesome. And did you want to do just one more?
Yeah, let's go for it.
Okay, perfect. So another one that came in is, how does one address absorption and digestion issues?
Yeah. So this usually, if you have absorption issues or digestive issues, it comes down to either that your the amount of stomach acid you're producing is inappropriate, you're not producing digestive enzymes the way you should, or you have something that's blocking your absorption, whether that is an infection or an overgrowth of bacteria or celiac disease. And so, again, I know this isn't the most helpful answer, but it kind of depends on what the cause is. But usually I start with stomach acid and assessing someone's stomach acid levels because it's very common that they're actually low. When we're stressed, our body turns down production of stomach acid, it turns down production of digestive enzymes, and it's very common for all of us to be chronically stressed. So that's where I start, but there are lots of possible causes.
Awesome. Thank you, Kim. If there's any other questions in this area, just post them in the chat box and I'll keep a dictionary of them all.
Okay, awesome. So next is diet. And so for years and years, dermatologists were saying, you know, what you eat doesn't influence the health of your skin at all. And the truth is that that is false. You know, our diet has a humongous influence on our skin, and whatever you put into your body will show up on your skin. And so you can take a pessimistic view of this, but I prefer to look at it as the right foods are powerful tools for achieving the skin that you're looking for and for healing your skin cells. And so, not only does food provide the building blocks that your skin cells need to be healthy, they also fight against some of the most common insults to skin health. So that's things like inflammation and free radicals, which we're constantly bombarded by every day. And so, you know, choosing the right foods can really help in the fight against both of those. And then lastly, a good diet is essential for optimal gut health. So we just talked about the importance of gut health, and diet is a big player in that. So, some of the things that can go wrong in terms of diet and what you're eating, the first and most obvious is a food allergy. I will say this is the thing that I run into least frequently in practice. And this is because if you have a food allergy, you probably know it. And that's because the reaction that you experience is usually very quick. So it's not hard to determine. If you break out in a rash when you eat something right away, you're probably just not going to eat that thing. But it is a possibility that could be behind, you know, your skin issues. The second and much more common option is that you have a food intolerance or sensitivity. And this is different from a food allergy. It's a different part of the immune system that's being triggered when we have a food sensitivity. And the symptoms are often very vague and they take a long time to come on. So it can take up to 72 hours after you eat a food to actually develop symptoms of a sensitivity to that food. And some of the symptoms, again, they can be things like headaches, congestion, digestive problems, joint pain, all sorts of vague symptoms that we're not really thinking about, in addition to skin issues. So, if you're finding that you have a lot of vague symptoms in addition to your skin problems, whether that's acne, psoriasis, rosacea, eczema, it could be a food intolerance or sensitivity. And then the last is eating inflammatory foods. And these are foods that just cause inflammation in most people. And so inflammation is unfortunately one of the main sort of root causes of skin problems. And then inflammatory foods also damage gut health and they lead to hormonal imbalances. And so this is something that can affect almost everybody. And so I'll definitely be talking about inflammatory foods next. But the most common food sensitivities that come up are going to be dairy, gluten, eggs, and yeast. This is not an exhaustive list. You can have a sensitivity to almost any food, but these are the ones that are most common. So if you're kind of, feeling overwhelmed, you're not even sure where to start, this is where to start. These are the most common things that come up. And I will say, in all my time practicing and leading people through elimination diets to help them figure out what their food sensitivities are or doing food sensitivity tests, I have not had a single patient not have a sensitivity to dairy. So I will say if you're going to start with one thing, start with dairy. See how you do if you eliminate dairy for a little while. And I know a lot of people are very resistant because cheese is delicious, but it really could be the underlying cause behind your skin issues. So that's the biggest one I see in practice, hands down. So when we're trying to figure out if you have a food sensitivity or intolerance, there are really two main ways that we can do that. The first is to do an elimination diet, and that's when you eliminate all the foods that tend to be common food sensitivities for a period of time, and then you reintroduce them one by one back into the diet in a very controlled way. And that way you can determine exactly how they influence you. And I lead patients through this exercise all the time. The second option is to do a food sensitivity test. And it is a good option. I prefer an elimination diet. It is the gold standard. It's really going to give you the most information. A food sensitivity test doesn't tell you exactly which symptoms are caused by which food. It just tells you which foods your immune system is reacting to. And so that's why I prefer an elimination diet. However, a lot of people would prefer to do a food sensitivity test, and that's a really great option if you're having all sorts of unexplained, vague symptoms, like I was discussing earlier. Then we have the major inflammatory foods. So the first one is gluten, and gluten isn't a food per se, but it is a protein that is found in wheat and other grains, such as barley, spelt, and rye. I have listed some of the gluten-free grains down there for you. Oats are technically gluten-free, but they're often contaminated with gluten at processing facilities. So if you want to make sure, you always have to get gluten-free certified oats. And so I did mention briefly earlier about celiac disease and how it is quite a serious digestive concern. And it does require complete elimination of gluten from your diet for life. And for a long time, we thought that the only reason to avoid gluten is if you had celiac disease. But as the research emerges, it is becoming impossible to ignore, the new diagnosis of non-celiac gluten sensitivity. And that's when you have a sensitivity to gluten that is not celiac disease. So the symptoms are not as severe, but there are still symptoms. And the main difference is that celiac disease basically always causes digestive problems, whereas non-celiac gluten sensitivity can cause vague symptoms without any digestive problems. And one of the main symptoms is skin issues. Random skin rashes, acne, eczema, psoriasis, rosacea, all of these things. And so it's definitely something you have to consider if you're dealing with chronic skin issues. Um, so gluten causes inflammation in the gut when it's consumed, and that leads to the development of intestinal permeability or leaky gut. And this happens in most people, not every single person, but most people. And the research is really reflecting that. And so this is why it's something that should be considered. And some of the factors that influence whether or not you will personally have a sensitivity to gluten are genetic susceptibility, the actual state of your gut microbiome. So, what does your bacterial balance look like in your particular microbiome? And whether or not you already have intestinal permeability from some other cause. When it comes to eliminating gluten from your diet, nowadays it's a lot easier. It would have been really hard to be a naturopath back in the day, I must say. Now I have so many options to offer patients. There's all sorts of gluten-free products available. So it's much easier to try this out if you're curious now than it used to be, that's for sure. The second is cow's dairy. And so cow's dairy contains something called A1 casein, which is a protein that is very inflammatory for most people. And similar to gluten, we're finding out that it's inflammatory for the majority of people, not every single person, but most people. And so a really important thing to note here is that goat and sheep dairy doesn't contain A1 casein. So if you're trying to play around with eliminating dairy from your diet, doing some goat's products or sheep's milk products instead are a good way to kind of make that transition a bit easier for yourself. Important to note, butter and ghee have such low levels of A1 casein in them that it's actually negligible. So you can keep butter and ghee in the diet, and that's because they're mostly fat and there's almost no protein. And the A1 casein is a protein. There's also lots of non-dairy alternatives available now. Similar to how I was saying, it's easier to eliminate gluten from your diet now. It's also a lot easier to eliminate dairy than it ever used to be. Between the cashew milk, the almond milk, the oat milk, you've got lots of options, which is really nice. Some people are also lactose intolerant, which is not quite the same. It just means that you don't produce the enzyme lactase that helps you break down lactose, and that causes lots of digestive issues. Important to note, lactose-free products still contain lactose and A1 casein. They are still dairy. All they've done is they've added some lactase to the product to help you digest it. But it still contains all the inflammatory proteins, unfortunately. And dairy is easily the most common dietary trigger of acne. So especially for any acne sufferers out there, again, this is really where I'd start. Cow's dairy also causes insulin to spike after we eat it. So when it was studied, and they made participants eat a bunch of different foods, and they measured their insulin levels after eating foods to see how much their insulin would spike. And insulin is a hormone that helps to regulate our blood sugar levels. And they found that dairy makes our blood sugar spike a lot more than we thought, not too much less than just having white sugar, which was quite shocking. So it has a similar effect on our health, and it leads to the development of something called insulin resistance, which is sort of the underlying cause of most cases of acne and hormonal problems. And so another reason why you should consider, playing around with removing dairy from the diet if you have some of these issues. Next one is sugar. So we know that sugar is not the best for us, but it really is quite inflammatory, and it causes inflammation in two different ways. The first is that it literally causes tissue damage. It is sort of like a piece of gum that attaches itself to your cells, and then it damages them. So that's not so great. And it also, like we talked about with the dairy, it causes some insulin resistance, which again is the root cause of things like acne and hormonal imbalances. It also triggers a process called glycation, which leads to the production of something called advanced glycation end products, which then leads to the breakdown of collagen fibers. And you may know collagen as the fibers that keep your skin nice and bouncy and youthful, and babies have a ton of collagen. And as we age, our collagen levels decline naturally. And so a lot of cosmetic procedures, the overall goal is to increase collagen levels, and sugar directly opposes that, and it breaks that collagen right down. So if you have concerns about premature aging, this is definitely one you want to be looking out for. And then lastly, it reduces microcirculation to the skin. So another thing that reduces microcirculation to the skin is smoking. And so it's not quite as severe as smoking, but it is comparable. And when we reduce microcirculation to the skin, we're reducing nutrient delivery to our skin cells. We're reducing waste product removal from the skin, and this can really have some negative long-term effects. So sugar is definitely one that is not helping any skin issues. So I listed some common names for sugar because it can come under quite a few different names. So usually when we think of sugar, we just think of white sugar, but it also encompasses things like cane sugar, cane juice, agave syrup, all these different things. I often get asked about coconut sugar, and a lot of people use it as an alternative because it has a lower glycemic index. But the difference in glycemic index is actually pretty minimal, and it still leads to the development of insulin resistance. So it's not one that I recommend if we know that you're dealing with some issues with balancing your blood sugar. So I've listed some of my favorite options here. By and far, my favorite is Lakanto monk fruit sweetener. It can be used as a one-to-one sugar substitute. It's completely natural. It does not cause your insulin to spike or your blood sugar to spike, and it does not have any weird aftertaste. A lot of people love stevia. I personally don't. I think it has a weird aftertaste, which is why I go for the monk fruit sweetener. But if you like stevia, go for it. It's a great option. And then I also really love Wellesley's apple butter. It's basically just mashed up apples, and it tastes delicious, and it's really good in baking. So that's a really nice sort of whole food source of sugar that you can use in your cooking and baking. The next inflammatory food to avoid is alcohol. And, we thought for a long time that as long as we consume alcohol moderately, it's okay. But the truth is that all the emerging evidence suggests otherwise. And even as little as 2 drinks per week can have long-term effects. And even as little as 1 drink per week can cause your estrogen levels to spike and to stay high. And trust me, this is just as distressing to me as it is to you. I love a craft beer. I love a craft cider. It's lovely to try them out. But it's unfortunately, we kind of have forgotten that alcohol is a poison that our body has to eliminate. And so our liver has to work really hard to get rid of it. And as it's working to get rid of the alcohol, it forgets to get rid of all the other stuff, such as estrogens. And so estrogen levels tend to rise quite significantly as a result. And so that really predisposes us to a lot of hormonal skin concerns. And then also it really increases the risk of breast cancer for anyone with breasts. So that's another really important thing to note. I've listed all the other bad stuff that alcohol does. It causes insulin resistance. It damages our gut bacteria. It dehydrates our skin. It shrinks the brain, especially the hippocampus. So it messes with your ability to regulate your stress levels, and that can have long-term effects on your skin as well, especially if you're dealing with an autoimmune concern such as psoriasis. Um, it actually impairs nutrient absorption in the gut. And not only does it cause inflammation, but it depletes the anti-inflammatory molecules that our body uses to fight inflammation. So it's kind of like a double inflammatory whammy. And so for all those reasons, trying your best to limit alcohol is going to be very important if you're dealing with a chronic skin condition. There's lots of really fun, sober, curious alcohol companies out there now that are producing very interesting, alcohol-free wines and spirits. So that's something that I would encourage, especially if you're like me and you really like the process of, trying different flavors. That's definitely an option for people. And then lastly, there are the vegetable oils. And so, unfortunately, these are some of the most inflammation promoting foods to consume. So, all the typical oils that you see out there: canola oil, corn oil, safflower, palm, soy oil, margarine, and vegan butter replacements. So, they're very high in omega 6 fats compared to omega 3 fats. And we need omega 6 fats. They are essential, just like omega 3s. That if Essential means that we can't produce them on our own. We must get them from the diet. But we really want to be consuming a lot of omega 3s and just a little bit of omega 6. But what's happening in our traditional diet is that that's flipped on its head. We're consuming a ton of omega 6, not very much omega 3. And when we tip the scales like that, it promotes inflammation in the body. And so the goal is to do this instead. And all of these oils are predominantly omega 6, which is why they're inflammatory. Um, they're hiding in almost all packaged and processed food. If you've ever read any food label, one of these oils is probably in there. The exception is there's a brand called Primal Kitchen that only uses avocado oil and olive oil for their cooking, which is really interesting. And then, you might come across a local health conscious brand here and there, but for the most part, they're using inflammatory oils. And it's used in almost all restaurant cooking because using things like avocado oil and olive oil is very expensive. And so, this is especially important for people who are eating out a lot. Even if you're making really healthy choices when you're eating out, you are still probably getting quite a decent dose of inflammatory oils. And so this really highlights the importance of cooking your own food as much as possible, and being mindful of what's going into your food. And you have full control when you cook your own food. So just another reason to, stay home and meal prep and make your own dinner. Okay, so now I'm going to jump into some other aspects of an anti inflammatory lifestyle, and then we'll do a quick question session afterwards. So, chronic inflammation, I would consider it a silent epidemic at this point. All of the research that is coming out is showing us that chronic inflammation is at the root of every single disease process in the body. And I can't emphasize that enough. Almost everything that goes wrong in the body, when we really investigate the root cause, it's chronic inflammation. And even things like anxiety and depression, we're finding out, are caused by chronic inflammation in the body. And so, inflammation is, when you think of it, you think of sort of redness, swelling, and heat. Whenever your body is injured or under attack, such as if you have an infection. And this is your body's attempt to protect itself. And it's really meant to be a very short lived response to deal with acute injuries and infections. But what's happening is that it's occurring long term and chronically now. And our body is not designed to deal with that. And over time, it causes a lot of cell damage and tissue damage. And then it leads to various disease processes. And it is the sort of main underpinning mechanism behind skin concerns. So, the best way to tackle inflammation is a two-pronged approach. The first is to reduce inflammatory inputs into the body and to increase anti inflammatory inputs into the body. And ideally, we're doing both, not just one or the other. So, some of the things that cause chronic inflammation, I've listed them here. We already discussed gut health. We discussed the foods that tend to cause inflammation, but things like high stress levels that are left unchecked. So, if you're really struggling with your stress, do reach out for help. It is quite important. Chronic infections. If you have recurrent and chronic infections, definitely don't ignore that. Poor sleep, smoking, the blue light from our electronics, which again was just as distressing to me as it probably is to you to hear that, certain medications, a sedentary lifestyle, and then things in your environment. So, environmental allergies and sensitivities. So, anything in your environment that causes your immune system to react, whether that's dust, pollen, dander, a chemical in a product you use, that will cause inflammation. So one thing I really like to do with my patients personally is test for inflammation. And so there's two really simple blood tests that you can use. The first is called high sensitivity C-reactive protein, or HSCRP. The second is erythrocyte sedimentation rate, or ESR. These are both, they're quite affordable. I think they're maybe like $7 and $9. And you can do them with your family doctor as well. But it's something that I really like to do with all of my patients to assess their levels of inflammation in the body, to see what's going on. So, some of the anti inflammatory foods to consume to reduce your inflammatory load. The first is omega-3 fats. And that we talked about earlier. We're trying to tip the scales, eat more omega-3 compared to omega-6. So the first thing you think of is olive oil, but also avocados and avocado oil, coconut oil, flaxseed oil. I put a little star beside that because flaxseed oil it actually goes rancid very quickly. And so you want to be very careful with flaxseed oil. It is very healthy, but you always want to purchase, if you're purchasing the oil, make sure it's in a dark bottle, store it in the fridge. If you're if you're doing flaxseed or ground flaxseed, I suggest buying it whole and then grinding it as you need it, and only grinding about a week's worth at a time, keeping it in the fridge or the freezer. All of these will slow down that process of breakdown and oxidation of the oils in there. And when they oxidize and go rancid, they're no longer anti-inflammatory. So that's why you want to really pay attention to that. All the fatty fish. So wild salmon, trout, sardines, mackerel, anchovies. I put wild salmon there because we're learning that farmed salmon actually is not that anti-inflammatory, unfortunately. So, which is really sad because it's the main salmon available. But if you do happen to see wild salmon, that's really what you're going for. I personally wait till it's on sale, and then when it is, I grab as much as I can and I throw it in my freezer. Otherwise, trout is a lot easier to find. It's a lot more affordable, and it's a really good option. Grass-fed meats. This is because when animals eat grass, they get a lot of omega-3s from the grass, and it translates into the meat that you later eat. But farmed animals that are eating, that classic feed, lots of corn and grains, they're not really getting a lot of omega-3s, unfortunately. And so it's not as healthy. And so grass-fed is really the best. Pastured and omega-3 eggs, and then some chia seeds, hemp seeds, walnuts, almonds. Spices. So a lot of the spices are anti-inflammatory. The most common one that we know of is turmeric, very anti-inflammatory. Probably one of the most anti-inflammatory things you can consume. But ginger is really high up there as well. And when it was actually studied and compared to non-steroidal anti-inflammatory drugs such as Tylenol and Advil, it actually was comparable in terms of reducing inflammation and reducing pain, but without the side effects. So that's just how powerful ginger is. So adding ginger to your diet is a fantastic option. And then we have a few others, cardamom, clove, rosemary, black pepper, which you definitely want to consume alongside turmeric. Black pepper actually increases the bioavailability of turmeric, so it will only potentiate the anti-inflammatory effect. So you usually want to consume those two together if you can. And then we have antioxidants. So the way we get antioxidants is primarily through our colorful veggies: red, yellow, orange, blue, purple, green, the colors of the rainbow. You want to eat all those veggies as much as you can. Green tea is another great source of antioxidants. This one is especially important if you are dealing with hormonal acne, because not only does it quench inflammation, but it reduces male hormone levels, which are often the root cause of hormonal acne. So green tea is definitely an important one. If you're consuming green tea, the best way to consume it is actually matcha powder. Matcha powder is just ground up green tea leaves. And when you consume that, you're consuming the entire leaf as opposed to just a hot water infusion of the leaf. And so you just get more benefits. And then all the leafy greens, all the fresh herbs, all the berries. So it's pretty easy. Get all of your veggies in and try and eat colorful veggies as much as possible. And that's how you're really going to hit your antioxidant quota. When it comes to berries, try and choose organic as much as possible. If you think about it, berries are delicious and everyone wants to eat them, even the pests in the garden. So they are very heavily sprayed, unfortunately, compared to other fruits and vegetables. So try organic if you can. And we're aiming for at least 6 to 8 servings per day of all your fruits and veggies. All right. And then blue light from electronics. Very sad development that we're learning about as we're researching the effects of the blue light that comes out of our screens. We're learning that it is actually quite inflammatory. It increases inflammation in the skin. It increases free radicals in the skin. It causes hyperpigmentation, breakdown of collagen, and photoaging comparable to UV rays from the sun. So, especially now living in such a virtual world, this is something that we really need to be mindful of. So, the best way to do that is, of course, to limit electronic use as much as possible. But if you are someone who has to be on your electronics all day for your job, then trying to mitigate that with some strategies that I've listed here is a good idea. So there's a couple apps you can use on your computer. One of them is called Flux, the other is called Iris. And try and use it during the day, not just at night, because when it comes to your skin health, it doesn't matter what time of day you're getting exposed to the blue light. When it comes to your circadian rhythm and your sleep, the timing matters a bit more. But when it comes to skin, we're just trying to reduce overall exposure. Doing night shift on your phone during the day, and then switching to a red screen at night. And so I've included instructions here on how to switch your phone screen to a red filter at night. So now's a good time if you want to take a screenshot or a picture of this so that you have the instructions. And it's really easy. You can set up a shortcut on your phone so that it does it automatically. So I'll show you really quickly on my phone. You just, oh, it looks all funny. But when you click the side button 3 times, the screen turns red. So it's really easy. I just do this once the sun starts to go down if I know I'm going to be on my phone. All right. Some of the other contributors to chronic inflammation that were listed there: high stress levels, smoking, and poor sleep. So if you're dealing with any of these issues, make sure that you address them. Don't sweep them under the rug. Yes, they're common, but that does not mean that they are not negatively contributing to your health. So make sure that you're doing your best to deal with these issues, and seek out help if you need it. There's so many options available to you, and especially for smokers. A lot of them feel like it's impossible to quit. There's nothing they can do. They just have to power through it. But acupuncture is very helpful, and there are some herbs that can help with it as well. So if you're a smoker, there are options to make it a lot easier for you. All right, so this is a good time to stop and have a little Q&A. So if there are any questions that you guys have about what I talked about there, feel free to send them in. And again, I'll answer 2 or 3. And then if there are any remaining, we will try and answer them afterwards via email or something.
Hi, Kim. So we got a lot of questions in
Ah,
this section.
okay,
So I'll do the first 2 here, and then I can just take a list of the rest of them and we can get to those later.
sounds good.
But the first one was, can you speak on gluten-free alternatives that are labeled and marketed as such, as opposed to naturally free gluten items? I hear many gluten-free alternatives replace gluten with extra sugar.
Yes, absolutely. So that is completely correct. Just because something says gluten-free on the label does not necessarily mean that it's a health promoting item. And so I am always encouraging my patients to read the ingredient labels. They do often try and improve the taste or the texture of the gluten-free product with other ingredients such as sugar. And so it's kind of like when they do fat-free products and then the sugar content soars as a result. So really being mindful of your ingredient list is going to be important. If you can eat whole foods that are naturally gluten-free, that's always going to be the first choice. And there are, lots of options that way. It might not sound super sexy, but chickpea pasta, lentil pasta, brown rice pasta. There's lots of grain-free alternatives for things like pizza dough, even tortillas and buns. I really like a brand called Unbun. Um, so just being mindful of the added ingredients and trying to choose whole food options as much as possible.
Okay, awesome. And then another question we had was, let me see here. Would fat and protein in certain types of dairy products like full fat milk or yogurt or Greek yogurt slow down the insulin response to a low enough amount?
It does slow down the insulin response. And that's why it's not quite as bad as consuming sugar. But what was discovered in this study that was conducted is that it doesn't slow it down as much as we thought. So dairy is kind of a curious, I'll say, food group in that way, in that it does spike insulin a lot more than we initially believed. And so if you're going to choose a dairy product, yes, I would choose full fat over low fat because that fat will blunt the insulin response slightly. But it is one of those curious products where we really didn't think it would spike blood sugar very much or insulin very much, but it does, unfortunately.
Awesome. Thank you. I've taken all the other questions and added them to the document for later.
Okay, perfect. We'll get to all those. I'm actually excited to go through them. Okay, so then we have functional detoxification and elimination. And so it's important to remember that our skin is an organ of elimination. That's one of its main sort of roles in the body. So some of the other organs of elimination are the bowels, the kidneys and urinary tract, the lungs, the liver. And so if our ability to detoxify and eliminate is impaired in any way, if any of our other organs are not, working at full tilt, then our skin will suffer because it's going to try and pick up the slack. And if something can be eliminated via the skin, our body will try. And so buildup of waste products in the body that aren't being eliminated do cause damage to skin cells. It does cause inflammation. And I've mentioned this, I think, twice before, but just for good measure, you can have buildup of hormones in the body if you're not eliminating them in your stool. They can get reabsorbed, and then that can cause a lot of hormonal issues, especially when it comes to estrogen. Often it leads to high estrogen levels. So, to ensure that you have healthy detoxification, number one rule, you need to have at least one healthy bowel movement per day. If you're having issues with constipation, make sure that you address that. A good place to start is to make sure that you're getting 25 grams of fiber per day to support optimal bowel movements. Make sure that you're drinking enough water when you do that, because if you increase fiber without increasing water, you can actually worsen constipation. So point number two, make sure that you're drinking 8 glasses of water per day minimum, and try and filter your water if you can. I've listed some brands there for you. Santavia is the most affordable and it's pretty easy to find. Berkey is the best, but it's the most expensive. So I tried to include a few different ones there for you. Avoid environmental toxins, so things like BPAs, dioxins, phthalates, plastics, and anything that has fragrance or perfume or parfum listed on the ingredient list. And that's because legally companies do not have to disclose what fragrance or parfum means. So it means it can be anything at all, any ingredient, but it's allowed to be kept as an industry secret. And so if you see that, you don't actually know what it is. So it's best to avoid, in my opinion. Eat enough complete protein every day to meet your individual needs. This is especially important for vegetarians and vegans because the liver requires complete protein in order to do its job. So, when people are doing a lot of juice cleansing and, it's great. They're getting a lot of phyto chemicals from their green juice. They're not taking in anything toxic at the time, but they're also not getting any protein. And so their liver can't actually get rid of any waste products that have built up. So the liver needs protein. Avoid alcohol and sugar because those both impair the functioning of your liver. And make sure that you remain active and you're not living a sedentary lifestyle. Movement improves digestive motility. So that means it keeps your digestive system moving and it promotes healthy bowel movements. It increases circulation and it moves lymph around. Uh, Lymph is kind of like the liquid that flows through your body that goes around and collects waste and then removes it. It's sort of like a second circulatory system. And it encourages elimination of waste products via sweat. So I've listed some foods to consume that are particularly good for your liver and encourage optimal liver function, since the liver is the sort of primary organ of detoxification. So take a screenshot or a picture of this if you'd like. We will also send out a recording at the end. But some interesting ones that are you're less likely to have heard of are dandelion root tea and milk thistle tea. Those are both really fantastic for liver function. And then we have gua sha, which is an ancient Chinese beauty practice that was used basically just for cosmetic reasons. And it utilized a jade tool, but we're learning now that it actually helps to move lymph. And so by doing that, it helps to improve detoxification and elimination of waste products, specifically from your skin cells. And it's a really lovely way to support the overall health of your skin. It's a relaxing self-care practice. It's easy to do at home. So I'm going to show you, I have a few gua sha tools here. So the first one is a traditional jade one. And you'll notice there are some similarities amongst all the tools, but they usually have some kind of a scalloped edge or a little V for targeting specific contours of the face. They usually have a long edge that is curved and a kind of pointy end for targeting specific areas. Jade was traditionally used because it was a symbol of affluence and beauty, but also because it's naturally cold. So it's very cooling and refreshing on the skin. You can also get ones made out of rose quartz, and they come in lots of different shapes. So I'm going to demonstrate some gua sha techniques that you can use, but another really great option is to check out, if you have Instagram, there's a great brand, it's called Wildling Beauty, and they have maybe hundreds of gua sha tutorials on their Instagram, so it's a really great option. When you're doing gua sha, you want to apply an oil to your face, and you want to make sure that your face is cleansed so you're not wearing makeup. I'm wearing makeup as I'm about to do this, which is why I'm not going to apply oil. But you really do want to, when you're doing it properly, you want to apply oil because you want a nice amount of slip on the skin. You don't want to be tugging. You want to use gentle pressure. That's because the lymph vessels that are running through your face, they're quite sensitive to pressure. And if you press too hard, you'll actually close them shut and you won't actually be moving the lymph around. And you want to keep your tool at roughly a 45-degree angle to your skin. And you want to target all of the areas where lymph nodes tend to congregate. So that's going to be just above the collarbone, all down the side of the neck, along the jawline here a bit, and in front and behind of the ears, especially. So I usually like to start with the neck. And so I like to work, I'll use the sort of long edge of the tool that is curved, and I'll start underneath the jaw and work my way down the neck like this and move towards the lymph nodes above the collarbone. And then I give it a little bit of a wiggle just to activate the lymph nodes that are down there. Ugh, my hair is getting in the way. You want to do maybe 4 or 5 slow, gentle sort of strokes with the gua sha tool, and then jiggle at the bottom every time to stimulate those lymph nodes. And then you can sort of anchor your skin a bit and use the scalloped edge to target just along the jawline like that. Move up towards the ear and wiggle. And it's really quite relaxing and lovely. And the major goal here is to always move from the center outwards and always towards a lymph node if you can. And you can also use this to break up any tension in the muscles. When there's a lot of tension being held in the muscles, what happens is that it reduces circulation. So I like to use the sort of pointy end of the tool and really get into the jaw and break up any tension. This is more for the muscle tension and less for the lymph. But I find that it's really helpful and it's very relaxing and lovely, especially if you're a jaw clencher or you are, if you have TMJ. And so you're just constantly moving outwards, being fairly gentle. And you will notice if you do one side of your face before the other, when you look in the mirror at the end, you will see quite a difference. And always use very gentle pressure around the eyes. And I like to do a nice sort of eyebrow lifting movement. I find it sounds silly. You don't think that it will lift the eyes, and that it'll stay up there. It seems like just a little temporary thing, but I notice such a difference. It really does just lift the brow, and it's just kind of a nice. This is more cosmetic, but and then I like to do sort of a movement upwards towards the top of the head through the third eye, but across the entire forehead. And then I like to finish off by doing an overall sweep. So sweep towards down towards the lymph nodes of the neck, all the way down to the collarbone and wiggle. And that's just an overall sweep to move all the lymph down. So that's just a really quick tutorial, but it's a lovely daily practice that you can do to help detoxify all the cells of the skin. And it's a really nice thing to do morning or night for yourself. All right, some additional testing to consider for your any kind of skin issue. I just wanted to make sure that I was thorough in terms of the testing. So for any skin condition, I always recommend taking a look at your vitamin D levels, your vitamin B12 levels, and an insulin glucose challenge. And that's because problems with insulin resistance can be the underlying cause of so many skin issues. And so I always like to do an insulin glucose challenge to see what's going on with someone's insulin levels and blood sugar regulation. Vitamin D is so important for the health of our immune system, for our hormonal health, for reducing inflammation. And so it's really central to just about everything we're trying to do when we're optimizing health. And it's important for every skin condition. If you have hormonal acne, especially, you want to take a look at some of these major hormones that I've listed here. And then if you have psoriasis or skin rashes, you do want to take a look at something called ANA, which helps to see if you might have some other autoimmune process going on, and take a look at the thyroid, because often autoimmune conditions come in multiples, and you might have an autoimmune thyroid condition, especially if you notice that your skin is very, very dry. That often is a thyroid issue. Or if you have very dark under eye circles as well, that's another one that is usually a sign of a thyroid issue. Okay, and lastly, we're going to finish up with skincare, and then I'll take some questions. So ingredients and products to avoid in your skincare. The first is harsh cleansers and soaps. And this is because our skin has a naturally built-in protective system called the lipid barrier, which is essentially a layer of fat or oil on the skin. And it's there to protect us from the environment and to prevent moisture loss, to prevent, pathogens from entering the skin or infecting the skin. And it's really essential for overall skin health. And harsh cleansers and soaps, unfortunately, really strip that away. And our body has to constantly be trying to produce that lipid barrier and keep it intact. And then we're constantly stripping it away over and over. So that can be it can really exacerbate a lot of skin problems. Uh, Also, soaps tend to disrupt the pH of the skin, which can also cause some issues. Skin should be naturally a little bit acidic. And if we are basically messing with that, it can cause a lot of issues, especially for acne sufferers, I find. Facial wipes, they contain a lot of crappy ingredients and preservatives because they are wet and then they have to stay in a package and not go bad. And they don't really remove your makeup very well. So often there's lots of remnants left and the skin can't really breathe properly. So I don't like facial wipes for that reason. I prefer using a proper cleanser. Baking soda, because of what I talked about, how skin should be a little bit acidic, baking soda is basic. And so it will negatively impact the pH of your skin. And I've seen a lot of people will notice it if they use a deodorant that has baking soda in it. I had so many patients coming to me with all sorts of strange rashes in their underarms. And turns out it was actually their deodorant. And once they switched to the same deodorant that was baking soda free, the issue cleared up. So be really mindful of baking soda in your products. It's used in a lot of natural products, especially. So if you're trying to go green and natural, just check the label. And then all of these sort of unfortunate chemicals that I was talking about earlier, the parabens, the phthalates, dyes, perfumes, they can cause a lot of sensitivity. They're unfortunately in a lot of cosmetic products. So trying to choose greener products is definitely helpful. So when it comes to cleansing your face, you always want to use a clean cloth and lukewarm water. Don't use super hot water. It can actually exacerbate skin conditions that are going on. If you're wearing makeup, you cleanse twice, once to remove the makeup and then a second time to actually cleanse the skin. If you're not wearing makeup, cleansing once is okay. I recommend cleansing every night. You don't have to cleanse every morning. That's optional. It works for some people. It doesn't work for others. I personally don't cleanse in the morning. I just do a quick rinse with water, and I find that's adequate, and a lot of people do. And then I encourage people to opt for an oil cleanser. And this is because an oil cleanser will not disrupt that lipid barrier of the skin. It also, sometimes that's the only thing you need to clear up your acne, as wild as that sounds. I've had a lot of patients after they switch to an oil cleanser, it gets rid of all of their acne problems. And that's because when you use an oil cleanser, your body doesn't have to produce as much sebum. Sebum is one of the ways that your body helps to moisturize your skin. And again, if you're constantly stripping it, it has to produce more and more to make up for it. But when you use an oil cleanser, the production slows. And so it can really help with acne, especially. I've listed a couple cleansers there for you that I really like. When you're cleansing your body, again, you want to avoid harsh soaps, especially if you're dealing with eczema or psoriasis or skin rashes on the body. And you want to use a gentle pH balance product. So I listed the one that I really like, and that's very easy to find at the health food store. I recommend a mist or a toner for my patients, and specifically a green tea toner. This is because in studies, green tea has remarkable anti-inflammatory properties and it helps every skin condition under the sun when it's tested. It also reduces sebum production and male hormone levels by up to 70%, which is shocking. That is incredible news for acne sufferers, hormonal acne sufferers. So you can make your own green tea toner at home if you'd like, or you can purchase green tea toners. So I've included instructions on how to do that here, and I've listed some brands that make some green tea toners that are nice and clean. So good time to take a screenshot or a picture again if you'd like to make your own toner at home. When it comes to masks, I avoid clay masks because they really dehydrate the skin. And again, when we're dehydrating the skin, we're only removing that lipid barrier that's so protective and healing. So if you do choose to use a clay mask, don't wait until it fully dries out and it's cracking. Try and rinse it off before that in order to reduce the amount of dehydration that's occurring. It can be nice for acne sufferers, especially to draw the impurities up towards the top of the skin. But if you're using it all over the face and you're dehydrating your face constantly, it's really working against you. Also, I usually tell my patients to avoid sheet masks, and that's because similar to the face wipes, they have a lot of preservatives because it's a bunch of goo sitting in a package and it can't go bad. And, you know, when we have a moisture rich environment that is sitting for a long time, that's ripe for the development of all sorts of bacteria in there. And so they have to use a lot of preservatives. There are a couple natural options that are, you know, good if you'd like to explore that. So I've listed those two there, but basically all conventional sheet masks are really chemical laden, and they can exacerbate a lot of skin conditions that tend to be sensitive to those kinds of preservatives. And then you can make a homemade green tea mask with matcha powder, and you can combine it with raw honey or yogurt and apply it to your face. And, you know, a lot of skin conditions are actually coming down to an imbalance in the microbiome of your skin. So, similar to how we were talking about the microbiome of the gut, the microbiome of the skin is very important as well. And so, yogurt is almost like a yogurt mask is like a probiotic for your skin. And so it's shown to be beneficial for a lot of different skin conditions. So that's another easy, quick thing that you can do for yourself. And if you add some matcha powder, you get a little extra inflammatory boost from the green tea. When it comes to moisturizers, I avoid moisturizers with silicones and coconut oil because both can aggravate acne, and the majority of my skin patients are acne patients. I have a couple recommended moisturizers there for you listed. I would consider a face oil instead if that's something that you can stomach. Again, it's really beneficial for the skin, similar to the oil cleanser. A lot of the oils that are used in cosmetics are unstable and they're inflammatory. And so they can make skin conditions worse. So I am quite picky about what oils to use. I really like 100% squalane oil. It's completely stable. It's very light and it absorbs into the skin well. It has anti-aging properties, and it's an oil that's naturally produced by our skin in youth and it declines as we age. So it's not some foreign oil that you're applying to your skin. And there's a couple brands that make it. The Ordinary is definitely the cheapest option. It's very, very, very affordable. So it's a great option. And it comes in a nice dark bottle as well, which is important for all your skincare. You always want to try and protect it from light. So a brown bottle is great. Then for sunscreen, I always recommend a zinc-based sunscreen over a chemical sunscreen for a few reasons. The first is that zinc-based sunscreens actually protect from UVA and UVB rays better than chemical. They protect from both UVA and UVB. They do not absorb into the bloodstream like chemical sunscreens, which can have harmful effects, mainly for your hormones. Um, they're reef safe. And zinc has very healing properties for the skin, and it's one of the things that we use to help reduce inflammatory skin conditions. So you get, you know, sort of double bang for your buck. You're protecting from the sun, but you're also healing your skin. I also avoid sunscreens with silicones, especially if you have acne. They can exacerbate acne. And again, I have listed a bunch of sunscreen ingredients there for you. They're all zinc oxide based. They're all clean. They don't have inflammatory, unstable oils added, or they're very, very, very low, like negligible. So those are all good options. So a good time to screenshot or take a picture as well of those options if you're looking for a sunscreen. So, in conclusion, the internal environment of your body is essential for the overall health of your skin. We really want to focus on reducing inflammation, really supercharging that diet full of anti inflammatory foods and antioxidant foods, and optimizing your detoxification pathways. Don't ignore signs and symptoms if you feel that something is off. You know, if you think your digestion is impaired, if you think that your hormones are imbalanced, if you're struggling to sleep, if you're stressed, Get help, do your best to address it. Again, these things are all very common, but that does not mean that they are normal. So don't sweep them under the rug. They're important messengers that your body is sending, and we want to listen to the messages that the body is sending when we're trying to optimize our health and manage skin conditions. So I know that was a ton of information that I threw at you, but again, I will do my best to answer questions that we didn't get to today, and you will get a recording. So if you need to re-listen, you can. And if you have any questions about naturopathic treatment for skin conditions, feel free to book a free 15-minute meet and greet with me. I love chatting with people. It's a quick chat. You can ask me any questions. I'll let you know what my thoughts are. And you can always email the clinic or call the clinic to book that or to send in your questions. And thank you again for joining me. And I really do wish you all the best on your health and wellness journeys.